Hey, also this week's residency reflection. I think it's week 4 of doing the reflections, 3 or 4, something like that. And this last week was our first full week in the clinic, kind of independently treating patients. I think there was maybe 1 or 2 patients. We had another PT come in, either just like as a second set of hands or as just like an observation kind of thing, just to make sure we didn't need anything. And then we kind of got started the back half of the semester for classes at GW, and little, how do I want to put this? A little bit intimidating, I guess, this past week, just knowing that I need to get faster with my productivity in the hospital. My patient time is really good. The amount of time I'm in the room with the patients, and I feel like I'm giving good interventions and having effective evals, but my chart review time and my documentation time is something I need to work on. So a little bit of pressure going into this next week just to try and bump the numbers up a little bit there, but I feel like I've kind of taken the time to go through and look at the way I was doing things, and they kind of gave us some resources to look at and how to adjust the way we're doing things to give us a little bit more time and speed the process up. So excited to try some of those out tomorrow in clinic. We're all day in the clinic with no mentor sessions, so it'll be a good chance to try and put some of those new systems to the test. And last week I also did see my first COVID positive patient. That added a whole other level of things onto it, and that was a little overwhelming, a little bit intimidating, just because there was a lot of other precautions that we had to take into account. You can't really bring anything into the room to write anything down, so you have to remember the vitals and whatnot, and then just kind of memorizing what the specific outcome measures that this hospital wants us to use are for, because I hadn't taken into account or thought of the fact that I couldn't really bring anything into the room. So I was familiar with them, but I hadn't memorized them, so that was a little just made me feel like I wasn't prepared, and I don't like to feel unprepared, so that kind of increased my anxiety and stuff like that a little bit. But I've been able to review them this weekend and feeling more confident about them this week, so if I have to do a COVID eval, I'll kind of have those ready, and I'll be able to just kind of do them from memory. So last week was just a little bit of a wake-up call, and also a little bit of just not feeling fully prepared for everything, which I don't like to do because I try to do everything I can to make sure that I'm prepared for every situation I'm going to encounter. But I think I've kind of remedied that a little bit with my prep this weekend, and excited to get moving into this week. We're also in the SCI part of the material at GW, and SCI is one of my favorite topics, so super happy that we're kind of in that part of the education program, and excited to keep moving forward with that, and then excited to start our mentor sessions this week. So that's kind of time where we fill out some forms and stuff beforehand, do some research to support what we want to do with patients, and then we have one of our clinic mentors come in to the session with us and kind of ask questions and prompt us, and it's a really good opportunity to practice in a setting with an expert clinician there to kind of give feedback and cue us with questions to help us think in a different way or change our thought process a little bit to get us to a higher level of clinical thinking and clinical appraisal and movement analysis and all that kind of stuff. So excited for those to start this week. It's going to add a little bit more work to our plate. So it'll be the first week where we have everything going on in terms of stuff at GW, full clinic schedule, and full mentor schedule. So full bore finally into the residency, but excited for it. A little bit nervous just in terms of building up that caseload time-wise, but and kind of being more efficient, but I feel like I've got some good systems down. So excited to see what this week brings. And yeah, I mean, last week was a good week overall. Just didn't feel quite as prepared as I wanted to, or kind of came to the realization that my systems weren't as efficient. And then also too, like, kind of hit me this, that I am in a big city now, and I can't do a lot of the country habits that I like to go do in terms of hunting and fishing and things like that, just because they're not as accessible here, and I don't have a car, so I can't drive out to somewheres and do those. But so that kind of hit me for the first time this weekend. And I think it's just because it's the time of year, but I think I'm also keeping busy with the clinic and stuff like that. So excited to keep moving forward with that and keep learning and keep growing. So that's this week's clinic or residency reflection. Thanks for watching, and hope you guys enjoy the videos this week. Thanks.